So, friends, yesterday we talked about uh, hyperthyroidism. Today we will discuss about hypothyroidism. Okay, hypo means low, okay, and thyroidism means the function of thyroid. Means here functional capacity of thyroid gland is decreased. Okay, so there's the reason we will call hypothyroidism. Okay, what are the hormones secreted by thyroid gland? T3, T4, and calcitonin. It means that these hormones are released less amount in the body due to the non-functional, dysfunctional, or less functional of thyroid gland. So what will happen? We have pituitary gland which releases one stimulating hormone, that is TSH, okay, to the higher thyroid gland to release T3, T4 calcitonin. So if the thyroid gland functions below than lower amount, so what will happen? We need more amount of thyroid stimulating hormone. Okay, we need more amount of thyroid stimulating hormone. Okay, so that's the reason the thyroid gland the is less functional. TSH releasing more into the blood. So pituitary function is more than less, more than normal. Okay. So this is the thing we have to remember. In this construct, uh, the TSH are high and T3, T4 are less, opposite. So it means it is hypothyroidism. In hyperthyroidism, what will happen? TSH are less because already thyroid gland is functioning more than normal. What will happen? The T3, T4 are more. Okay, so this is the basic difference between hypothyroidism and hyperthyroidism. So what are the causes? Okay, what are the causes? We have primary hypothyroidism and we have secondary hypothyroidism. Primary hypothyroidism, secondary hypothyroidism. Primary hypothyroidism means the involvement of thyroid gland itself. Okay, there is no involvement of pituitary gland or hypothalamus gland. Okay, only thyroid gland is affected. So we named as primary hypothyroidism. Okay, next we have secondary hypothyroidism. Secondary means in that constant. Okay, uh, the thyroid gland involved, the pituitary gland involved, maybe hypothalamus also involved. So combination of more than one gland we uh, named as hypo secondary hypothyroidism. Okay. So what are the causes? What are the reasons? What are the etiology? First is it is hereditary disease mostly. Okay. And second is it is due to the uh, stressful life, or what we can tell that habitual life that involves mostly using of junk food, bad habits, okay, stressful light, late night sleep, okay, overthinking. All this may be cause of hypothyroidism. Okay. And second is any infection which causes hypothyroidism. And second is using of drugs which affect the thyroid gland. Okay. And sometimes there is unknown reason also which can cause hypothyroidism, and mostly in pregnancy. Okay. Pregnancy, the if you doesn't take proper amount of diet or iodine, okay, which leads to cause of hypothyroidism. Okay. So these are the reasons behind the causes of hypothyroidism. Okay. So we need to understood about that. Okay. So first is we have hereditary cause, and second is infection, and due to the any thyroid gland disorder. Okay. And unknown cause or pregnancy, sometimes decreased taking of iodine. Okay. So which leads to cause of hypothyroidism. Okay. And already I told you that the person who have sleepless nights, okay, and stressful life, okay, proper improper diet, okay, improper diet, taking junk food, coffee, tea, and alcohol, smoking, anything they are taking, they doesn't have proper diet to maintain the body, to maintain the health. So causes, which triggers the thyroid gland, or which may lead to hypothyroidism. Okay, okay. So this is the thing we have to remember. Next is very important, the clinical features. Very long list about the clinical features. Okay, we have to understood clinical features. What are those? So we have very numerous types of symptoms you can see in the body. Okay, like they are physical first, mental, and metabolic disturbance you can see in the body. What are those? Let's discuss. Okay, physical, mental, and metabolic disturbance you can see that first is weak. Patient will become weak, and most common type of symptom of hypothyroidism is over sensitive to low temperature. Okay, low temperature. So he will feel shivering, cold. Okay, and they want to warm his body. They will cover with coat, with sweater, or they will wear the blanket. They will take the uh, blanket. Okay, because of oversensitivity of temperature due to the low temperature. Okay, and their skin become dry. Okay, skin become dry and rough also because of the poor metabolism. So these are the, you can see the physical symptoms easily you can observe. Not only skin, you can see the nails, and you can see the hair fall, nails become bitter, and they will like someone bited like this. You can see that, and the muscles become very weak, joints become very weak. They have neck pain, back pain, and knee pain. All these pains you can see. And female cases, what will happen? They will have delay menses, or sometimes increase the cycle of the menstrual period. Okay, these are the female related symptoms you can see. And there is a puffiness in the eyes. Okay, and they have continuous, sometimes they have urination. Okay, and headache. Okay, these are the symptoms or clinical features you can see related the body. So let's see one image here. With this image you can have the very basic idea. You can see that brain fog related, brain related symptoms. You can see that hypothyroidism can affect your memory and your ability to think clear. This mental fuzziness is sometimes called brain fog. Okay, forgetfulness sometimes. These are the things we have to remember. And hair thinning, hair become thin because of the uh, uh, low amount of hormones, metabolism disorder, peripheral neuropathy. Okay, and they have numbness. Okay, and everything that goiter, the size of the thyroid gland increases, heart risk also heart attack risk is also increases. They have a chance of gallstone because the due to the metabolic disorder they have the constipation. And the female menstrual cycle changes will seen. Okay, and having mental health issues, eyebrow thinning, jaundice, high blood pressure, slow metabolism. They have the weight gaining also, stomach bloating, heartburn, dry skin, and weakness. So these are the symptoms you can see, the or clinical features you can see. And the you can see to the body what can the they have the slow speech. This speech is very slow. Okay, and you already we studied about skin is dry, rough, and thick. And the most important, patient become obese. This is very important sign. Okay, and they have sometimes they have tachycardia. Okay, the patient have hypotension in some stages. Sometimes they have the hypertension according to the age. And okay, so most important is obesity. Okay, so because of low metabolism, patient is hungry, they want to eat food in large amount. So the excess taking of food which leads to obesity, mostly in female, the weight gain is seen. Okay, so what are the diagnosis criteria? So we have TSH, T3, T4. We'll see all this in the report. Okay, so TSH will decrease, T3 sometimes T3, T4 also decrease. Okay, sometimes TSH increases, T3, T4 decreases. Okay, TSH mostly increase. It means hypothyroidism, which low amount of T3 and T4. Okay, so all these are the things we have to remember. So these are the things we have to notice that in the patient, and have ask the history, ask the related daily routine, and everything related to the patient according to the symptoms. Then you will able to understand the patient is suffering from hypothyroidism, and related uh, tests have to be done. Okay, so which will give the proper knowledge to us to diagnosis. Okay, basically this disease will take time to recover. Okay, first recover, then then you have to heal, then you have to cure. Okay, these are the steps involved in this disease. So you need to advise to take one to two, three according to the symptomatic remedies, also according to the diagnostic remedy. So to improve the functions of thyroid, we will need to give S2, L1, BE. Start with D5 and go with to D4 because D4 is necessary for because of hypothyroidism, low amount of function of thyroid gland. Sometimes you can do S in place of S2, S3 also to be taken. Sometimes S here also C2 or C3 when one G. Okay, D5 to D4. Okay, and third one is that the patient is weak. This is the most important thing you have to remember. Patient is very, very weak. Okay, that is because of that you need to give metabolic remedy, either S1 RE or S10 WA. Okay, so it will improve the metabolism. It will not only improve the digestive system, it will also improve the metabolic process. Patient will have the energy to gradually he can recover. Okay, other symptoms related, you can advise the patient, but initially you need to give these remedies which will not help not only to recover the patient from the thyroid, but also the symptoms which arise due to the hypothyroidism. Okay, so these are the things you have to remember. Okay, so if any doubts, kindly ask.